A very good evening. From stories around the world to stories here at home, this is the National News Broadcast. I'm Vidushni Sadish Kumar.
I'm Movin Hettiaraj and here are today's headlines. The number of fully cured corona-infected patients has increased to 7,723. 537 recovered patients left hospitals today. The malfunctioning PCR machines have been restored. Distribution of 5,000 rupee allowance and dried food packages is being conducted successfully. Minister Mahindananda says government will purchase 300,000 metric tons of paddy in the next season.
In your local stories this evening, the Health Ministry says the number of fully recovered patients from the COVID-19 disease has increased to 7,723. 537 recovered patients have left the hospitals today. 27 fully cured patients have left the Pinnavala COVID Treatment Centre today. They were residents of Colombo. Last week, 3,264 fully recovered COVID-19 patients have been reported. Majority of recoveries in last week were reported on the 5th of this month. The number amounted to 765. That was the highest number of recovered patients recorded in a single day. 400 COVID-19 infected patients were identified in Sri Lanka yesterday, but on the same day, 563 fully recovered COVID-19 patients have left hospitals. Meanwhile, it has been reported that 3,350 fully recovered corona patients of the Deiraj COVID cluster have also left the hospitals. 11,824 PCR tests were conducted yesterday up to now. 580,598 PCR tests have been performed in the island. 257 corona-afflicted patients were reported from Sri Lanka today. They were associates of the Paliguda COVID cluster. Director of the Colombo East-based hospital, Priyantha Karnaratna, says that the malfunctioning have been repaired. The 30th corona-related death was reported yesterday. The deceased was a 23-year-old youth undergoing treatment at the Angoda IDH hospital. The victim was a resident of Mutual. The death was attributed to complications of COVID-19 associated with a diabetic condition. Funeral of the deceased took place at the Colonnava Cemetery yesterday, and it has been confirmed that 23 inmates of the Valikada prison have contracted the COVID-19 disease. There were 22 female prisoners among them, and one of them was the spouse of Saharan Hashim. 87 more employees of a garment factory in Horana have been identified to be infected the COVID-19 disease. Accordingly, the total number of infected persons have risen to 153. The Colombo East-based hospital is functioning as the national center to treat pregnant women afflicted with the COVID-19 disease. Director of the hospital, Dr. Priyantha Karnaratna, says that 27 pregnant mothers are undergoing treatment at the hospital. The Ministry of Health, in association with the Dialogue Asiata company, have made arrangements to provide robotic PCR testing facilities in the premises of the Bandula International Airport. 400 sets of testing equipment have been donated. It has been pointed out that these PCR tests enables to reduce the period duration of receiving of results of the tests to 2 hours from 8 hours. Sterilizing of state and private institutions due to the COVID-19 pandemic is taking place. Accordingly, the premises of the Sri Lanka Rupavahini Corporation were sterilized today through the assistance of the Sri Lanka Air Force. The Gunawardena District Hospital has been turned into a center to treat COVID-19 patients with effect from today. The center is able to treat 100 patients at a time. The Galle District Executive Officials Association has donated protective health equipment to the hospital today.
The Chief Epidemiologist, Dr. Sudat Samaravira, made a statement explaining the new quarantine process initiated by the Ministry of Health. He said several key changes have been introduced to the COVID-19 quarantine process.
At the moment, there is a confusion about the quarantining practice in our country among some people, that it should be clarified that earlier that all the people who are first contacts of a COVID-19 patient were admitted to a quarantine center and were monitored for 2 weeks at that place. But now this has changed, that the people are quarantining at their own residences. Beginning of the quarantining, some people were undergone PCR testing depending on their risk of exposure. Then towards the end of the quarantine period, again all the people's PCR has been done, and that we have identified whether they are infected or not. Only if they are not infected, that they were released to homes, followed with self quarantining for another 2 weeks. But now all the people are quarantining at their home, and if some person is unable to quarantine at their home because of the social conditions or medical conditions, then they will be quarantined at an institution as previously that we have done. But here also the testing policy has not been changed. At the beginning of the quarantine, if the person is at a higher risk of exposure, they will be subjected to the PCR testing. If they are negative, they will be continuing the quarantine for 2 weeks. Towards the end of the 2 weeks, that we will be doing another PCR testing to identify, to detect whether these people are infected or not. If they are infected, they will be admitted to a hospital or intermediate treatment center. If they are not infected, then the quarantine period will be completed. Whether they are quarantining at an institution or home, that it doesn't matter. Doing a PCR at the end of the 2 weeks, that it will be continuing as usual. As well as that the treatment policy has been changed recently. Earlier, that when the people are discharging after 2 weeks of they are in hospital, that we were doing 2 PCR testing, and then if they are negative only, that they were discharged. But with the evidence, the global evidence and the medical experiences, as well as in our country experience, that we can see that this for the asymptomatic, that the people who are not showing any disease condition like signs and symptoms like fever, cough, shortness of breath, that these people need not to undergo PCR testing. That if they continue to be without symptoms for 2 weeks, that means that towards that end of the 2 weeks, that these people will not infect other people. So because of that, doing a PCR test or 2 tests is useless. So because of that, the government has taken a decision to discharge all the asymptomatic patients after 2 weeks if they are symptoms free throughout the period without doing a PCR. But after they are discharging, they have to be self-quarantined at their own residence for another 2 weeks. This ensures that they will not transmit the disease to other people.
Police media spokesman Deiraj Ajit says that the quarantine curfew imposed in several areas is scheduled to be lifted on next Monday. He further says that around 2,700 persons have been arrested on charges of violating the curfew. A quarantine curfew is being imposed in 110 police divisions in the Western Province and also in the police divisions in Kuliyapitiya and Ahaliyagoda, as well as in the Kurunegala Municipal Council limits. In addition, the police divisions of Giriyulla, Mavanalla and Hemmathama have also been isolated. The police and the police special task force is continuously engaged in search operations using roadblocks to apprehend those who violate the curfew. A hand bomb and several weapons were detected in a search carried out on a 3-wheeler and a van in the Hinati-Gahalanda roadblock in Kalutara. 7 suspects have been taken into custody in this regard. The program to send via post medicine to the residences of the patients registered at clinics has commenced island-wide with effect from today. Minister Gamini Lokuge says that a special program is underway to fulfill the transport requirement of the people with the reopening of the country. Minister Vasudevanaikara says that people in curfew-imposed and isolated areas are being given the opportunity to pay their water bills in convenient manner. The Colombo Manning market is scheduled to be reopened for traders and consumers according to proper health guidelines. Minister Rohitape Gunawardena says that import and export procedures are being carried out without obstruction even under the corona pandemic. He made these remarks in an inspection tour of the Colombo port premises. Distribution of 5,000 allowance and dried food packages valued at 10,000 rupees is being carried out successfully under the Divisional Secretariat division level. A sum of 7.3 million rupees has already been spent in this regard. Several families in the Gramanildar divisions of Kudabellana and Midelvita in the Gampa district have been quarantined. The 5,000 rupee allowance has been provided to 532 persons in the Gramanildar divisions of Avriyavatha and Katnaika in Katana. Low-income earners in Kotugoda and several other areas have also received the allowance. 308 low-income earners in the Ratmalan Divisional Secretariat Division who have lost their livelihood due to corona pandemic have also received the 5,000 rupee allowance today. Several families in Kolonnava who were deprived of jobs due to the corona pandemic also received the 5,000 rupee allowance. Today, 250 million rupees have been spent in this connection. 50 million rupees have been distributed among 13,612 low-income families in the Valalavita Divisional Secretariat Division. Food bags were also handed over among 48 families in 4 isolated villages. 182 quarantine families in the Dehiwala Divisional Secretariat Division have also received the 10,000 rupees worth of relief items. Distribution of 10,000 rupee food bags among quarantine families in Wadua and adjacent areas has also commenced today. 55 families undergoing self-quarantine in Rattota were benefited through the program to distribute 10,000 rupee bags of food. Division Secretariat Division in Matale also received their relief items today. Dried food bags were handed over to 423 families in the Ambagamo Divisional Secretariat Division in the Norelia district. The first stage of the program to provide bags of food valued at 5,000 rupees each has taken place in Nochiagama and Vilache Divisional Secretariat Divisions in the Anuradhapura district. 100 families were benefited. Police media spokesman Deiraj Ajit Rohana has presided over the event to distribute dried food to low-income people in the Torrington Square area in Colombo 7.
Minister Bandula Gunawardena says that measures have been taken to distribute rice at guaranteed price by the Lanka Sutra from next Monday. He further says paddy mill owners have agreed to supply rice at a guaranteed price. Minister Bandula Gunawardena has made these remarks during an inspection tour of Satos outlets in Anuradhapura district. Minister Bandula Gunawardena said Satasa is ready to provide food and essential items to the people during the pandemic period. He said that there were adequate rice stocks with Satasa, and private mill owners have also agreed to sell rice according to guaranteed price. Meanwhile, Minister Mahindananda Alutgamage mentioned about a new plan to create a buffer stock of rice to avoid unnecessary price hikes in the future. He said during the next cultivation season, government will work with farmers to gain extra harvest. Therefore, the government can create a buffer stock to minimize the impact of black market rice mafia.
A period chanting and almsgiving were conducted in the Madamulana residence in Virakatia in parallel to the 53rd commemoration of late Deiraj Pakhsa. President Gotabaya Rajapaksa, Prime Minister Mahinda Rajapaksa and members of the families have attended these events. Paying of floral tributes at the monuments of Deiraj Pakhsa and Dandina Samarasinghe Disanayaka Rajapaksa took place last evening in the presence of President Gotabaya Rajapaksa, Madam Ayama Rajapaksa, Prime Minister Mahinda Rajapaksa and Madam Shiranti Rajapaksa. Ministers Chama Rajapaksa and Nama Rajapaksa, Chandra Rajapaksa, Basil Rajapaksa and parliamentarian Nipuna Ranawaka and family members were also present on the occasion. A Pahan Puja has also taken place at the statues of late D.A. Rajapaksa and late Mrs. Rajapaksa with the attendance of the members of the families. The Perit chanting ceremony was conducted by the Mahasangha, headed by Chief Incumbent of the Hapugampotha Purana Mahaviharya, Venerable Middenye Indra Thera, Chief Incumbent of the Palle Mulana Giruvasaya, Venerable Sapugasyaya Dhamratana Thera, and Chief Incumbent of the Atula Dakshina Rama Viharya, Venerable Vakamule Chandra Vimala Thera. The Mahasangha, headed by the Chief Sanganayaka of Matara Hambantota, Venerable Dr. Devale Gama Dhammasena Thera, Chief Adhikarana Sanganayaka of the Ruhunumagam Pattua, including the Giruwa Gam Dolos Dahasrata, Venerable Talampuruwe Indrasumana and Sanganayaka of Matara Hambantota, Venerable Beligalle Sarnapala Thera, have attended the almsgiving ceremony. Family members have followed religious observances adhering to protective health measures.
The chairman of the Presidential Commission investigating into the political victimization, former Supreme Court Judge Upali Aberatna, has decided to take legal action against several parliamentarians of the Samik Jana Balavegaya. Several parliamentarians of the SJB, including Harin Fernando, J.A. Alavathula and Mayantha Dissanayake and Nalin Bandara, have submitted a complaint to the Commission yesterday requesting to conduct an investigation under Clause 70 of the Bribery and Corruption Act with regard to an alleged misappropriation of state funds by the Commission. The MPs have also pointed out the Presidential Commission have superseded the common law of the country. Chairman of the Commission has informed the Secretary to the Commission yesterday to take legal action against the relevant parliamentarians of the Samagijana Balawegaya. The legal measures are to be taken under the charges of defaming the Commission in accordance to the Clause 105(3) of the Constitution and Clause 10 of the Commission Ordinance. Summons are to be issued today to 4 MPs to report to the police unit of the Commission to give statements on the charges insulting the Presidential Commission.
The Department of Meteorology forecasts on a higher probability of occurrence of thunder showers accompanied with strong lightning in several regions in the island. The department informs the general public to follow adequate security precautions in such occasions. Heavy rainfall exceeding 100 millimeters may occur in certain areas in the western, Sabragamur, northwestern and southern provinces, as well as in certain locations in the Nuwara, Bandula and Gunawardena districts. Strong provincial winds could take place at times of thunder showers. People should not remain outside or under the trees at times of thunder and lightning. They should always stay inside a protected building or in a closed vehicle in such instances. The general public is also advised to refrain from using electrical equipment connected to telephone or electricity cables. In times of strong windy situations, there is a possibility of the falling of trees and electricity cables. The Department of Meteorology also requests the general public to seek the assistance of officials of the regional disaster management centers in the event of an emergency.
Investors in Sri Lanka say they will continue to be in the country, expressing their confidence in the role of government during the pandemic situation. Speaking to Rupavahini, several investors said they had adopted a series of measures to ensure the safety of their employees in their factories.
There are 1,615 factories which are registered under the BOI Sri Lanka, which are dispersed all over the 25 districts of the island. Around 600,000 are employed in these factories, and another 133,000 are contributing to the production process inside the 14 investment zones, and other millions make their bread through the indirect employments provided via these factories. More than 70% of the export income is provided by this workforce. COVID-19 pandemic became a greater challenge for Sri Lanka's industrial zones.
We're getting very good guidelines from BOI about what is necessary to do to protect the workforce, and we're strictly following. So PCR testing, face masks, the use of hand sanitizers, social distancing, all of these things we're strictly adhering to and following. We do also have our own stocks of face masks to a higher grade, and we're giving those to people that are in an AC environment because we feel that the spread is more likely to be in an enclosed environment. We're also giving that to people where we consider risks are a bit higher. Especially now when all the shops are closed, this is important that we have our own stocks because we can issue it at critical times like this. But also too, the safety and welfare of our people is a large part driven by our ability to pay our employees good salaries and bonuses and incentives and things like that. And in order to do that, we need to be able to ship. That's a fundamental thing. It doesn't really matter how big a company is or how small a company is. We have to earn money to pay our employees. So with the support of BOI, we have definitely been able to continue shipping, and we've been able to continue paying our employees their salaries. And I think that that's very important, that we support them and we provide for their livelihoods, and we've been able to do that up to date. When we consider the safety of our employees, we also need to consider their livelihood, and we need to protect their livelihood, and that would be our approach to the matter. I feel that Sri Lanka is a good place to come and invest, and I feel that being under the purview of BOI, particularly being inside an export processing zone, has offered us a lot, and me in particular as a foreigner, a lot of protections, you know, for things that are different and that I wasn't aware of in my previous business practice experience. So being inside the zone and having the support and the protection of BOI, particularly, you know, we work closely with the Biagama office. You know, we found that their support and their engagement with us has been critical to our success and our continued expansion, which we continue to expand. I would be highlighting to any investor that Sri Lanka is a good place to come, and especially to come inside the export processing zones and to engage closely with BOI.
In spite of all these challenges, we have taken various steps with the close coordination of the government. Here I must emphasize that we all have learned from first wave to this time, where the government is very proactive. Various steps in advance were taken. Government, all the authorities, along with the Board of Investment, health authorities, which includes MOH, PHI, Navy officials who are coordinating all this with us for the PCR test, the police officials, and various time-to-time coordinating meetings are being happening. Although there are certain issues, but various issues, whenever arise, meetings are being done and problems are being resolved, which is a big plus point as compared to previous first wave and second wave. We also as the investors have taken various proactive steps, but still there is a suffering in the sense where loss of orders during this period. Although the first wave still not overcome many of the companies, then the unfortunately second wave has come. So loss of orders, delay in the orders due to lockdown or less attendance of the people, delay in the orders ultimately resulted into the suffering of the bottom line and the profit and loss of the companies. But we together with the help of government, we are working and in such a way that the suffering should be overcome as early as possible.
Board of Investment says that number of measures have been adopted to ensure the safety of the free trade zones.
Sri Lanka has recorded $1 billion or close to $1 billion worth of exports consecutively in the last 5 months, and the BOI entities numbering around 1,600, employing around 500,000 people, contribute close to 70% of these exports from the country. Indeed, the COVID pandemic or the resurgence of the COVID had impacted Gampaha, which housed 5 of our largest industrial zones. That has resulted in certain factories being closed and not all employees being able to come to work or report to work due to the lockdown, the curfew being imposed. As BOI, we've been working very closely with the Ministry of Health, the Tri-Forces, the COVID task force, the police and the health services, and most importantly, the investors themselves and their employees try to get this outbreak under control. Just to report, like as of today, we have done close to about 25,000 PCR tests, all paid for by the institutions or enterprises themselves to keep their workforce safe. Many have gone over and beyond and even hired hotels to house their employees who have tested positive, taken the initiative to provide dry rations or food for the employees who are at the boardings, and have taken concerted effort to manage the well-being of the employees, also adhere to the guidelines that have been set by the government and the Ministry of Health, and also to keep the economic engine going, try to balance all three: health, safety, and also the economy.
Meanwhile, the state Katina Puja ceremony and the ceremony on the dipping of the sacred romb in Pandukala is scheduled to take place at the historic Somavati sacred site tomorrow. This is the first Katina Puja ceremony that is to be held under state patronage after the era of King Parakramabahu II. Recalling the history, the villagers in Madirigiri Busopura area have prepared a Katina robe by using traditional cotton thread by the means of handloom machines. State Minister Deiraj Jayasekara has presided over the ceremony to carry in procession the sacred Katina Chivaraya to the state-sponsored Katina Mahapinkama today. The sacred robe is being carried in a motorcade to Somavati sacred site today. It will be placed at the police guard post and will be brought in the procession to Somavati sacred site in dawn tomorrow. The sacred robe will be offered to the Mahasangha tomorrow, and it will be dipped in Pandukala by using local law materials.
The Ratana Sutra has been recited in temples across the country to invoke blessings on the country and to wish good health for the people around the world in the backdrop of COVID-19 pandemic. A week-long chanting of the sacred sutra was concluded at the Sri Sambuddha Raja Purana Viharasthana in Vallampitiya this morning. The event has been organized under the patronage of Chief Incumbent of the Viharya, Venerable Hanguranketa Vimalananda Thera. Pirit Pen and Pirit Nool were presented to several institutions, including IDH Hospital and the Colombo Harbour, by the Dayaka Sabha of the Viharasthana. The Ratana Sutra is also being recited at the Udalamatta Swarnabimbarama Mahaviharya in Gaul under the patronage of the Chief Incumbent of the Viharya, Venerable Yatalamatte Palitatera. A mobile vehicle propagating Ratana Sutra discourses was travelling along the streets from Alut Nuwara Devalaya in Mavanalla to Sri Dalada Maligava in Kandy today. The journey has been organised by a businessman in Hingula Mavanalla. A Ratana Sutra Deshana Pinkama is presently being conducted at the Sri Nagabodhi Purana Viharasthana in Doranuwa, Ruwanvalla. The event has been organised by the Viharasthana Dayaka Sabha.
That's it for tonight's English News Update. Thank you for joining us. Good night.
Good night.